And now they're catching up.
Yeah.
The days without fever are more rare.
Exactly.
I take them to the emergency room if my kids don't have a fever.
Welcome to Family Med Distilled for April 2024, also known as
Family Medicine Distilled, or Dad Joke Medicine.
You got it. In this video, we are going to talk about top articles relevant to primary care in 2024, as well as
we're going to just flow through this other article on urinary incontinence.
and then
Is the article on cough?
apparently, yeah. And then we're going to wrap up with a groundbreaking article. Massive study. Is Tylenol, acetaminophen, paracetamol safe in pregnancy? But first, let's go through top articles.
Top articles. So we're going to start with one about lipids. So this one frustrated me because all of a sudden I'm in that guideline.
Yeah, all of a sudden the articles are relevant to
They're
you.
relevant to me. I much preferred it when they were about, screening for STIs under the age of 30, for gonorrhea and chlamydia in Canada, for everyone. But no, now it's about lipids.
Yeah, and as we get older, the other day I looked at a medical textbook and the table of contents looked like my past medical history. So, statins and high-dose lipids. Treat to target. Do we treat to target? Do we aggressively get that down? Because that's what the guidelines recommend.
So this concentrated on treating to target, or this like start low, go up. And also specific to South Korea study. So I don't actually know any South Korean docs. That maybe it's a different practice style, why they did this study. Do you know what the North Korean study said on this?
No.
No, it's silence.
Oh, okay. We
No.
haven't heard from them
No
yet, I guess.
studies coming out of North Korea yet.
All right. Now, they took 4,400 patients in this study, and they compared the one group, they reduced their lipids. They tried to treat to an LDL target of below 1.3 to 1.8. And the other group,
They just gave high dose.
gave them a pill.
Boom.
Torvastatin, 40 milligrams, or rosuvastatin, 20 milligrams.
Yeah, I think if patients are tolerating the high dose, I think there's a validity to this. We know we're not testing as often.
Does it work, though?
Does it work? Well,
And it's exactly what it said. 3 years later,
yeah.
no difference.
Oh, interesting.
No difference in cardiovascular deaths, no difference in all-cause deaths. So I think you're absolutely right.
Yeah, you just think about all the repeat visits. You're kind of setting it and forgetting it.
Yeah.
Like, that's what you're going to do. Now, ezetimibe, I think they used in a small group.
Well, they found that the folks who, when they're treating to target, they ended up giving them more ezetimibe.
Interesting.
Because they weren't getting to target. But we know ezetimibe, not that great evidence. It's not first line, not
And
as
side
helpful.
effects as well. Yeah, so, for me, if I can get my patients, instead of treating to target, I'm going to give you this and say, we're done.
Yeah, so
check your cholesterol one more time, and that's it.
focus on ezetimibe. We're going to give
Instetimib.
high-dose statins because it doesn't actually make much of a difference when it comes
Yeah.
to
And
treating to
myalgia
target.
was the other interesting thing, wasn't it?
Yeah,
So
exactly.
not in this study, but do you remember?
Yeah, we just saw in a different study about myalgia. It turns out after 1 year, the rate of myalgia is identical in if you give somebody a statin or if you give them placebo.
Yeah, so there's like a baseline pain of being old and on a statin. That's what it is.
Yeah.
14% of people. It's going to be you and me. Put it this way. Did you wake up this morning? Were you sore?
No comment. Everywhere.
Everywhere, yeah.
Well, thanks for giving us the stats on statins.
Statin stats. There we are.
Hang on.
So let's move on to...
We are going to go to We Go V. That's the brand name for this next medication, semaglutide.
Semaglutide. Okay. And tell me
celiacs
about
hate
it.
this drug
Why?
because of the glutide.
Oh, those like super sensitive to gluten.
Yes, they're
like
so
even
sensitive.
the word.
They're sensitive to things that are very sound like gluten. So what is this study's question? Can semaglutide reduce cardiovascular events in people who are obese and, don't have diabetes?
Don't have diabetes, but do have known cardiovascular disease. That was the key population here.
So let's find out what the study said. So 17,000 adults.
Yeah, it's big enough.
And what did they find?
Yeah, so after 40 months, so 1, 2, 3, it's a weird 40 months. Like, why did they go 3 years and a bit? I'm sure there was a bit of fluffing to get to the right months to get something valid
Not
out of
an
these
industry-funded trial, really?
Yeah, no, they never do that.
Okay.
No, it's like a parent-funded study. Earlier sleep is better.
Yeah.
Cardiovascular events, death from all cardiovascular causes, non-fatal MI or stroke, occurred in 6.5% of the people on semaglutide, and then 8% with placebo.
That's right.
No difference in mortality.
Mortality was the same, but the semaglutide group was probably a bit happier because 9% of them lost weight versus only 1% in the placebo group.
Okay, so happier being less heavy.
Yeah,
But
and
once again, no more time. And then you got to think about the cost.
cost is
as
a big
well.
one.
Lightens your pocket.
Availability is a big one. Yeah, you lose weight, you lose money. And then availability is hard to find. And finally, a lot of GI side effects.
I think we see that across this class, don't we?
Yeah, we see that with all of those ones. Speaking of class, let's get brushed up on RSV.
Oh, what does RSV stand for?
Respiratory Syncytial Virus.
Oh.
No relation to
Syncytial.
HSV.
HSV different.
Big difference.
Is it?
Yeah.
Oh. You're a good
there's
doctor.
Vaccine now. I know my alphabet.
Oh.
All 24 letters.
For a second there, I was like, is there 26? Or
Yes, there is.
25?
I know all the numbers. I can tell you each one. 1, 2, 3, 4. Which should I keep going?
Yeah, keep going.
No, we don't have time for that. So RSV vaccination, does it work? Is it helpful? And what does this study tell us?
So bottom line, at just about 7 months, RSV vaccination prevented 1 case of RSV-related lower respiratory tract disease for every 379 people vaccinated.
That doesn't sound great, but there's a lot of confounders in the study because what if it was 14 months or what if they tracked over a few years? Maybe they would have had better results. Also, this was done in the middle of the COVID-19 pandemic. There was not a lot of RSV going around.
That's true.
It was like COVID-19 pandemic was the only window in time that my kids have not had fever or runny nose.
Yeah, it was wonderful, wasn't it? And now they're catching up.
Yeah.
The days without fever are more rare.
Exactly.
I take them to the emergency room if my kids don't have a fever. I take him in, I'm like, my kid is well today. He does not have a viral gastroenteritis. He does not have an upper respiratory tract infection. His ear doesn't even hurt. There's got to be something wrong with him.
Something is terribly wrong. My kids' nose run so much they want to medal for a marathon.
Wow. But you know what's weird? You know what's weird about your nose running? Why do your feet smell?
I don't know why my...
Well, your nose should smell and your feet should run. It's always the opposite.
Oh, I get. Okay, yeah.
Yeah.
Pretty complex when it comes to your higher level dad jokes. More like a grandpa joke.
Oh.
What would a grandpa joke look like? We never even asked that before.
I don't know. He couldn't survive your bad dad jokes.
Won't make it to grandparenthood. So let's talk about this study. It was 25,000 adults,
age 60 or older, and they were healthy. Right, they excluded people who had unstable comorbidities or resided in long-term care. They were or immunocompromised. So you're looking at a really healthy 60-year-old who you're talking to about giving an expensive vaccine. It was a couple $100, I think.
And 0.3% of the folks with placebo got RSV. So your baseline number is pretty low. So you need a pretty high-powered study to find out if there's a difference. The folks who did get the vaccine and not placebo, they got RSV at a rate of 0.06%.
Yeah, I think bottom line for me, I'm going to be talking to my patients, maybe if this is covered, not a lot of adverse events, but am I going to make my patient pay out of pocket for this? Probably not.
Probably not. They did get adverse events, like you mentioned, pain at injection site, fatigue, and the most selfish adverse event, myalgia.
People are so self-centered, aren't they?
Yeah, no one ever complains about your algia.
Yeah.
It's a shame. So what's the next study we want to talk about? This one irritates me.
Why?
Because it's about irritable bowel syndrome.
Oh, not the patients.
Actually,
the
no,
bowels.
in all seriousness, I love this article because it's real life.
Yeah.
Because people come to you with IBS symptoms, and hopefully we've excluded the bad stuff. And then we say, try the FODMAP diet. There's a great app from Monash University, the FODMAP diet app. Should have been called the FODMAP app.
FODMAP app.
FODMAP app.
They left a joke on the table.
Unfortunately, so. But then you say, well, have you tried medication? They've always tried something like antispasmodics. And that's the population in this study. 463 patients just like that. And what did they find?
And so they found that for those patients, your second-line treatment with amitriptyline actually had pretty decent results. And the reason this is a great one because it's real-life medicine, like you said. First line doesn't always work. That's why we have second line. That's why your patients always come to me afterwards, after you fail, to get real medical treatment. So amitriptyline superior to placebo with 60% of patients having symptom relief versus 45 of those didn't take placebo. Number needed to treat is 7.
That's phenomenal. And once again, we just heard about the most selfish side effect, the most selfish medication. Amitriptyline. So let's move on to this article is of real pain in the neck or low back acutely. Now, if we give these folks opioids, It's going to bite you in the neck.
Ooh, ouch. What else bites you in the neck?
Dracula.
Ooh, that's a dark. that joke should never see daylight.
Yeah, because he's a necromancer.
Ooh, 1, 2.
Very good.
Nice. Okay, but this I think this is a signal article of larger trends where we're seeing opioids not effective short term, long term with long term adverse effects.
Yeah, it's amazing. Pain was actually worse with opioids at 1 year later.
That's wild.
People, if you gave them oxycodone, their pain score was 2.4 compared to if you gave them placebo, it was only 1.8. So there was no difference in pain intensity if you gave them oxycodone or placebo at 6 weeks either.
Yeah, for acute neck or low back pain. Now, obviously for these patients, we're ruling out any badness in the neck or in the low back, but functioning, quality of life, healthcare use, absenteeism, results were the same or worse with opioids. So this is one that goes back to do no harm.
Yeah, and I mean, we always want to talk about those non-pharmacologic treatments, and there's been great studies for low back pain for, yoga, tai chi, massage, acupuncture. And chiropractic is an option. I personally avoid recommending that for neck pain in case of the very rare but possible risk of vertebral basilar artery dissection. I actually had a really good chiropractic joke.
Oh, did you?
It's not ready yet. It needs adjustment.
Oh, no. Move on to the next article.
You sound like you're having an actual bowel movement. So what do you give to the person who has everything?
Penicillin.
That's right. This next article is for penicillin allergy. And there's a couple great tools. This one talks about the PenFast tool. There's another one called the very creatively named penicillin allergy delabeling tool.
Pad their resume with that article.
This is like a very real situation. You ask your patient, what are your allergies? I'm allergic to penicillin. And you ask, what was your reaction?
I don't know. My mom told me, my parents always said, or I had some sort of reaction as a kid. So really common.
Yeah, my neighbor had a reaction, so I just tell people I'm allergic to penicillin.
I was just sitting there minding my own business. I was just chilling. I was penicillin.
Oh, dear. So this is very painful.
What do you mean?
Just sitting with you and hearing your jokes. But just as a side note, had to say that because of these jokes are so cringe.
But so what do you do for these patients? So this study looked at an RCT 282, gave them either 250 or 500 milligrams of penicillin, and 98% of them were delabeled.
Yeah, so
that's amazing.
It's as safe as standard of care penicillin skin testing. So the process is you do this questionnaire. The PenFast tool, it's very simple. I've used it many times now. I like to print out the results so the patients don't think that I'm just some wacko who's like, actually, you're not allergic. Ta-da! So it's very objective. You ask, have you had a serious reaction? How has it been more than 5 years? Was your skin peeling? Did you have something like Stevens-Johnson's? Did you need treatment? If they say no to all the questions on the PenFast tool, I tell them your chance of having a skin allergy test show that you have a penicillin allergy is less than 1%.
Less than 1%. You can go right back to licking mold off your bread. You can eat moldy bread.
Amazing.
You can eat
and
moldy bread.
And that is quality of life right there. That's what patients
that's
really
quality
want.
of life, right? You want your toast before you go to work, and you're like, there's a bit of mold. You ever done that? You ever just pick off the moldy bit and then toast it anyway?
I do, with the prices of how much Loblaws is gouging us for groceries these days.
Like gluten intolerance be gone.
Yeah, exactly.
I'm going to eat this bread, moldy bread.
So great study, because then when the PenFast score was very low, the old-fashioned way was you would send them to an allergist at that point, but this says, why don't you just give them 250 milligrams of amoxicillin?
Yeah.
Wait for half an hour. And 98% of patients, they were able to remove their penicillin allergy label.
That's amazing.
It is amazing.
Take this penicillin, go over, be a chillin', and then I'm going to give you the rest of your prescription. But I think as we enter this era of more antibiotic resistance, if we can remove those labels and use those basic antibiotics, I think we're going to be better off long term.
My wife is very familiar with syphilis, professionally, not... Let me rephrase that. My wife works
You're not helping.
at an STI clinic where she treats other people who have syphilis, not her or myself. Again.
Yeah.
But
positive for life, man.
Stay positive.
RPR.
All those memes and inspirational quotes. But they use this all the time there because
right.
penicillin,
Yeah.
intramuscular penicillin is your first line treatment for syphilis.
We're seeing so much more, aren't we?
Yeah. And if you say, I've had an allergy to penicillin, well, then all of a sudden your good options are gone.
Interesting.
So it's a phenomenal tool. PenFast, I highly recommend using it in your practice.
Quick to use. Some may say it's fast.
Moving on to assessment of urinary incontinence in older adults. And I love this article because they say urinary incontinence is not a diagnosis. If someone's dribbling, you don't just say diagnosis incontinence. No.
Are they basketball players?
The sports medicine article. Yeah. No, the point is we got to find out, why do they have incontinence? What type of incontinence do they have, so we can treat them better?
Yeah, that clinical classification of incontinence is very relevant. So they break it down in this article into 4 different ones. So overactive bladder, it's usually urgency, usually daytime frequency or nocturia. And then next one, do you want to talk about stress urinary incontinence?
Yeah, this one's causing a lot of angst.
Just thinking about it.
Very stressful topic. Stress urinary incontinence is, of course, when people say, I cough, I sneeze, I have a history of smoking, and then urine just comes out by itself when I'm having some Valsalva. And
chronic cough, COVID is the worst side effect of chronic cough.
Mm-hmm. This one might be a bit boring, but the next one is very fun.
Is it? Why? Because it's functional. There's got to be more. Was that your dad joke? You just took the first 3 letters. That's cheap. That's cheap. Continence requires the individual to recognize the need to void. So, like a child, my child would have functional incontinence.
Yeah. And or elderly folks, they've had a stroke. They've got cognitive decline.
Yeah.
They don't know that they should go up and use the toilet, and so they unfortunately soil themselves. An older person restrained by bed rails is another example they give. So,
okay. Yeah, functional incontinence in kids is not fun. The number of times my kid's been too excited to play to realize he has to go wee, and they have a wee accident.
You've been christened by the
christened
by the liquid of fatherhood.
The liquid of fatherhood.
The many different sprays and soils.
Yeah, I like how it's like he has a wee, but it's me that has to do the cleanup.
Yeah, well,
he's not very involving.
I'm sorry about that fact that your child does what every child does. Overflow.
The Niagara Falls problem.
Exactly. Yeah, there's too much urine in there, and there's some reason for it. And so you see this, folks, with chronic painless urinary retention. You see this in folks where the pressure can no longer be contained by the sphincter.
Yeah, so this is the urethral sphincter being overflown by the increasing intravesicular pressure, small frequent volume voids, and dribbling incontinence.
Now, there's actually a 5th kind, if you think about it. The 5th kind is going to be a combination of more than one of these. And that's actually quite frequent as well. They don't list a rate or amount. But that's why when you see these folks, you got to ask them about the storage symptoms. Are you having urgency, frequency, nocturia, stress incontinence?
So this article comes out with a great mnemonic. Diapers, diapers, should be considered. So patients with new onset, and you're going to assess them. What are you thinking about using this diapers
D is for
mnemonic?
delirium, I is for infection.
And then infection, they put a special note about avoiding treatment of asymptomatic bacteriuria, and then atrophic vaginitis.
Your mind is stuck on your commute.
Nothing going on down there.
Atrophic
vaginitis, which has now changed the name to genitourinary syndrome of menopause. And then pharmaceuticals, and they give a big list here.
It's a huge list, but honestly, you can summarize it pretty closely down into antihypertensives and psychiatric medications. So specifically, ACE inhibitors, calcium channel blockers, diuretics as antihypertensives, for example, as well as your alpha agonists and antagonists. And then psychiatric drugs, psychotropic drugs, lithium and SSRIs.
So that's a great way to break that down as you get to the middle of the diaper. So those are your number one things that you're thinking about.
For number one.
For number one.
Yeah.
Should be top of mind, top of diaper. Psychological excess urine output. I've had a few patients with this who've tried different medications, and then you go to a house call, and they're walking around with one of those Stanley mugs.
Oh, wow.
It's en vogue right now.
Yeah.
Do you use one?
Stanley tumblers. I don't watch TikTok anymore.
Oh.
I've now recovered.
No. Yeah.
I do not know about the latest trends like
Stanley.
Stanley.
So it's just they're drinking a ton of water because they're thirsty, and that's sometimes the cause.
Hydro homies, keep it real. It's a thing.
Is it?
Oh, yeah.
Oh, okay.
Where are we at now? Reduced mobility and stool impaction. So that's why physical exams should include a digital rectal exam.
There you are. You put your finger on the diagnosis.
Yeah. So complete physical, complete history. Just going back to the history, you want to ask about the storage symptoms, ask about the voiding symptoms, ask about the post-micturition symptoms, and then, get a medication comorbidity list as well.
Brilliant. So that's great. Now I'm excited. What's going to happen to these patients afterwards? You're going to bring them back. What if you're successful in treating them?
So I don't know, because this is part 1, and they haven't released part 2 of the article. But actually, I'm assuming part 2 is going to be treatment. They're probably going to talk about medications and probably non-medication options.
I'm doing one of them right now.
Really? What is that?
That's a Kegel.
Oh, wow. Actually, some of you may not know this, but Paul's actually a very accomplished Kegelist. Is that
Kegelist,
the term
yeah.
you prefer?
It's kind of it came out of some gymnast activity that I did before, yeah.
And you've competed, right?
I can be international Kegel competition.
The ick competition.
Yeah.
And what's the
They don't televise it because it's just not that entertaining.
No, it just looks like this.
Yeah.
What's the mascot of the Kegel?
Maybe the Kegel Seagull. Kegel Seagull, yeah.
Right.
He's conveniently got fecal incontinence whenever he flies over you as well.
Right?
Yeah.
No lineups for the bathroom at the Kegel competition. So let's wrap up with this game-changing article. So this one is huge. Just came out this month from the Journal of the American Medical Association, April 2024. Because in 2021, a group of scientists made a public statement and said, hold on, you should forego acetaminophen during pregnancy because of the risk of ADHD and autism. So they said, forego acetaminophen unless its use is medically indicated.
Why else would you be using it?
Because it tastes good? Some
I don't think it does.
Some have the sugar coating.
Do they?
Oh, you must buy the generic
I
version.
buy the generic.
Yeah, if you get the
one,
brand version.
Oh,
delicious.
Oof.
Yeah.
Give it to your kids and stuff.
Yeah, I'm
Is it a
turning
treat?
a lot more yellow lately, but other than that, I feel great. No pain.
Teaching kids the colors of the rainbow using for failure.
So, that definitely is a failure of concept right there. Yeah. So these folks, and understandably, if someone is pregnant and they say, I've got pain, and you say, well, there's no good options. NSAIDs are not great at term. And now we say Tylenol, we said this since 2021, might cause autism, ADHD. So tell me about this study. How was this one structured?
So this one was quite a large N. Was it 2 million?
2 million.
2 million.
2.5 million.
2.5 million. So that gives me some clinical confidence.
Yeah, and then they followed them up.
Was it in Sweden?
For years.
Sweden.
So this was from 1995 to 2019.
Wow.
And then, they included all the children born in that window, and then they followed them up until 2021.
Okay.
So some of these kids had
some kids for ages. So they would have picked up if there was ADHD.
Yeah, definitely.
And what did they say? What did the study say?
No.
Okay.
There's no association. So
amazing.
Massive study. So why did we have that kind of a signal suggesting that there might be autism, ADHD associated? Well, they said it was probably because of sibling co-founding. So those older studies didn't have
twins.
They didn't have sibling control, and so it was the co-founding that was the cause.
Co-founding siblings.
Exactly.
How do you co-found siblings?
I don't know. I lost.
You
my
lose them
kids
both.
a while ago. Haven't seen them in a while. I think that is a wrap for April 2024. Dad Joke Medicine. That's right. This is Family Med Distilled.
And this is Dr. Paul Dillon signing off for Dad Joke Medicine. We'll see you next month.
See you next month. Take care.